All right, good afternoon, everyone. I hope you're doing well and getting excited for the upcoming holiday season and time that you can spend with friends and family. I'm Kayla Rivera. I'm the Community Engagement and Trainings Manager for HealthLinks, and we are a signature program of the Center for Health, Work, and Environment at the Colorado School of Public Health. Our mission is to work with employers to create healthier and safer workplaces. And part of reaching our mission is through this webinar series where we invite content experts to come and speak about their work, how they're engaging employers and workplaces, and strategies that you all can walk away with and take back to your workplace to create healthier, safer, and happier environments. So today's presentation, as you can see here, is Diabetes Prevention, Tiny Steps to Improve Health in the Workplace. And I'll get into introducing our speaker, Vanessa Avila, who I'm very excited to have with us today. But first, just wanted to cover a few quick items. As many of you are familiar, these are our HealthLinks benchmark, which comprise our online HealthLinks assessment. And that is what organizations take to become a certified healthy workplace. And so today, we are hoping that this webinar can really help you improve in the area of health policies and programs. We tried to tailor all of our webinars to fit within one of our 6 benchmarks because the ultimate goal is to help you achieve success in those areas, as we know that research and practice have shown us these are really sustainable elements of your workplace health and safety program. Couple housekeeping items. Everyone is kept on mute throughout the duration of the presentation, but if you have a question, please feel free to use the chat box. It's in your control screen, and you can directly type out your question there. I'll be monitoring it, and depending on if it's super pertinent to that exact slide or not, I may take it at that moment and ask Vanessa, or perhaps wait towards the end where there will be time for questions. Also, as a reminder, this is being recorded, and so as a follow-up, I'll be sharing a link to the recording along with a copy of the slides and any other resources that may be pertinent to this exact information presented with you today. And if you're not following us on our YouTube channel, HealthLinks, then I encourage you to do so. That's where we post all of our previous webinars, and we update that every month after the recording is completed. So check us out there, but I will also be sending the link to that in an email, which will also have a quick, literally the quickest question ever, a scale of 1 to 10 of how did you like the webinar, and if you could quickly rate that for us, that helps us kind of get a gauge on what we're doing and how we're impacting everyone. So please take the time to provide your feedback. Okay, so I'm going to dive right into introducing our presenter, Vanessa Avila. So Vanessa is passionate about translating nutrition into bite-sized, personalized pieces that are easy to apply, and is dedicated to guiding people to improve their life by changing their behaviors in a way that's fun and complements their life. She also wholeheartedly believes that most of healthcare happens outside of the doctor's office. Vanessa has founded a healthcare startup focused on preventing and reversing type 2 diabetes in underserved Hispanic and Latino communities by integrating culturally sensitive health education, technology, and targeted behavior change strategies. Vanessa is a registered dietitian nutritionist, and she received her master's in nutritional science at California State University, Long Beach, and is certified in integrative and functional medical nutrition therapy. I'm really thrilled to have Vanessa. I was privileged to be able to go to school with her back at Cal State Long Beach, and we did a fellowship together and worked really closely with the Latino community delivering a childhood obesity prevention project. And so I am very familiar with all of her knowledge and skills, and it's exciting to be able to have her present on her new work and how you as an employer can really help in the process of reversing type 2 diabetes. So I will not say any more. I'll go let her take over from here and enjoy.
Thank you, Kaylee, for the introduction, and hello, everyone. So like Haley mentioned, I'm the founder of a health technology company that designs programs to prevent type 2 diabetes in the Hispanic Latino community. We're launching a pilot program in June 2019, so that's very exciting. But my purpose today is to introduce you to the Diabetes Prevention Program. Now, I work in a different capacity with the Diabetes Prevention Program, meaning not in a corporate worksite wellness setting, but my goal is to introduce you to the DPP in hopes that this presentation may spark some curiosity and interest in learning more about the Diabetes Prevention Program and how you can implement that in the workplace with your employees. And I do provide some resources to kickstart that learning. Next slide. Thank you. So why it matters. So diabetes itself is estimated to be 30.3 million people in the United States, or about 9.4% of the population have diabetes. What's interesting is that back in 1958, so about 60 years ago, only 0.93% of the population was diagnosed with type 2 diabetes. So we see almost a tenfold increase from that. And about 90 to 95% of those diagnosed with diagnosed with diabetes are diagnosed with type 2 diabetes, which is the most preventable form of diabetes. And about, yes.
I'm so sorry. Do you mind, I don't know if you're on the phone or not, but maybe just speaking a little bit louder. I think we're having a little bit of some sound issues.
Sure. Okay, is this better?
Yes, that's better. Thank you.
Okay, awesome. Thank you. Okay, so about 1 in 4 people with diabetes don't know that they have diabetes. So that's one. The second thing is looking at pre-diabetes. So now pre-diabetes is more prevalent. We have about 84.1 million Americans, adult Americans, with pre-diabetes. So that's about 1 in 3 people. And 90% of people with pre-diabetes don't know that they have it. So 9 out of 10 people. And the CDC currently lists diabetes-related mortality as the 7th leading cause of death. But there is a new study that suggests that diabetes-related mortality is really underreported and may actually be the 3rd leading cause of death in the United States. This is typically, it can be underreported because people with diabetes often have other health conditions or comorbidities like heart disease, high blood pressure, obesity, and cancer. So in the death certificate, when you have an option of putting heart, disease or diabetes, heart disease is most of the time picked over diabetes. So this is just to say that looking at diabetes is very, very important. And more so than that, looking at pre-diabetes so we can prevent the development of type 2 diabetes. Next slide. Okay, and when we look at the cost of diabetes, it's really a large burden on society. When we take into account the higher medical costs, loss of productivity, premature death, and then the intangible costs that come in the form of reduced quality of life. So in 2017, the estimated cost of diagnosed diabetes was $327 billion, of which $237 billion were in direct medical costs and $90 billion were in a reduced productivity. So care for people who already have diabetes accounts for 1 in 4 healthcare dollars. And people with diagnosed diabetes have an average medical expenditure of $16,750 per year, of which $9,600, which is more than half, is attributed to diabetes. So we can definitely start to see the increased cost in medical spending. Next slide. And $9,600 is the average medical expense an employee may face over the first 3 years after transitioning from pre-diabetes to a diagnosis of type 2 diabetes. So if we're able to delay or reverse pre-diabetes, we can start to see the cost savings of expenses that would have happened if the individual or employee didn't transition from pre-diabetes into type 2 diabetes. So the good thing about this is that we can definitely see it in the numbers with the medical expenditure. So again, this is one of the reasons why it's very important to start thinking about your employees' health when it comes to pre-diabetes, not only because of the medical costs and the cost savings, but also because you would be improving the quality of life of your employees, which is always a good thing for business to have a healthy workforce. Next slide. Okay, so loss of productivity. So diabetes-related lost productivity costs the United States around $69 billion per year. And employers experience loss of productivity in many different forms. So one of them being time off. So employees with diabetes may need to take some time off of work to deal with health issues. They may have to go to doctor's visits. They might have episodes of hypoglycemia, which is when the blood sugar is too low. They might feel hot flashes, dizziness, so symptoms from diabetes, leading them to take time off of work. You may have higher turnover rates. So employees with diabetes may need to stop working due to serious health complications and disabilities. For example, a big one that's coming up is chronic kidney disease. So kidney issues for those individuals that don't take care of their diabetes, it can lead to kidney issues, which then can lead to dialysis, which again can lead an employee to not be able to work anymore. And then there's also reduced morale. So a sick workforce may not be as energized, they may not be as productive. And compared to people without diabetes, those who do have diabetes are 100% more likely to develop hypertension, 80% more likely to be hospitalized for heart attacks, 50% more likely to be hospitalized for a stroke. So we can definitely start to see the impact that diabetes has on the lives of people, of employees, and how this can impact the productivity in the workplace. Next slide. Okay, so why does this matter to an employer or to a business? So like I just showed, we see type 2 diabetes contributes to rising medical costs. And as an employer, you're really in a unique position to promote awareness and change in your workforce when it comes to health. You can help your team take those small steps that can result in a big payoff, like an active, healthy workforce. Next slide. Okay, so now I'm gonna go over what is prediabetes, since you may have heard the term but may not be 100% sure of what it is. So next slide. So remember, about 9 out of 10 people with prediabetes don't know that they have it. But prediabetes is a condition where your blood sugar levels are elevated. They're higher than normal, but it's not high enough yet to be diagnosed with diabetes. So you're kind of in that middle ground where you don't have normal blood sugar, you don't have diabetes, but you're just right there in the middle. And it's really that opportune moment to do something about it, to know that you're pre-diabetic and start working to reverse pre-diabetes and prevent the development of diabetes. When someone has pre-diabetes, they're also at a higher risk for thank you, for health problems like heart complications, again, kidney issues, hypertension, cholesterol. So there's a lot of other things that come with it. Next slide. Okay, so how is prediabetes diagnosed? So prediabetes is diagnosed in 3 different ways, but I'm gonna focus on the A1C here on the left and the fasting plasma glucose. So these are blood lab tests that you typically get done at the doctor's office. So let's say in a physical, we usually get our A1C tested. When you get your A1C tested, this number tells us the average blood sugar for the past 2 to 3 months. And this number, you can land in one of 3 spots. You can have a normal, blood sugar, you can be pre-diabetic, or you can land under the diabetic range. Now, it's very important to know your number and for your employees to know their number, because it's very different to be told you have pre-diabetes, and it's different to be told you have pre-diabetes and your A1C is 5.7, because as you can see, the 5.7 is closer to normal blood sugar, or being told you have pre-diabetes with an A1C is 6.4. Again, as you can see, that's closer to diabetes. So it's really important for individuals to know their A1C number, because that's going to let you know your risk. The other form of a test is a fasting plasma glucose. This is usually done, in the morning, 8-hour fast. The thing with this measurement is that it only tells us our blood sugar from the last day. So if I know I'm going to the doctor and I know I'm going to get tested, I might be more mindful of what I'm eating. And this lab test might come up maybe normal or, a little pre-diabetic. It might not give us a clear idea. So the best test would be the A1C. But this is how individuals get diagnosed with pre-diabetes or diabetes. Next slide. Okay, so assessing pre-diabetes risk for your employers. So one of the ways they can do it is if they go to their doctors and get their A1C or a fasting glucose tested, like I showed on the last slide. Another way that you can do it is by having conversation or awareness with your employees and sharing the different risk factors to pre-diabetes, so they can understand if they're at risk, and if they are, take some steps to prevent the actual development of type 2 diabetes. So some of the risk factors are being 45 years of age or older, being overweight, not physically active, having high blood pressure, family history of type 2 diabetes, or having gestational diabetes during pregnancy. So again, it's really important to have this conversation with your employers, because if we know that 1 out of 3 people have pre-diabetes, we can assume that 1 out of 3 people in your workforce has pre-diabetes. And if left untreated, pre-diabetes can progress into type 2 diabetes. And we went over all the costs that comes from that development of type 2 diabetes. Next slide. There's also a risk assessment test that you can give to your employees. So they can fill out this risk assessment, and each of their answers is given a certain point scale. They add up their points, and it tells them if they are at a high risk for having pre-diabetes or if they're at a low risk. You can also take other steps to understand your employees' pre-diabetic risk. You can include the pre-diabetic in-health risk assessment and a biometric screening. You can also analyze your claimed or lab data to estimate the number of those with pre-diabetes. Again, awareness of how many employees may have pre-diabetes is one of the first steps to get the conversation started. Next slide. So the good news with pre-diabetes is that it's something that is reversible, that going from pre-diabetes to normal blood sugar is very possible, and that someone has pre-diabetes doesn't mean that they have to develop type 2 diabetes. And even with type 2 diabetes, I'm not sure how familiar you all may be with the complications of diabetes, but even if someone has type 2 diabetes, they don't have to suffer from the complications. So there are things that we can do. But in this presentation, I'm focusing on the pre-diabetics. Next slide. Okay, so the way that we start to prevent the development of type 2 diabetes is by implementing the diabetes prevention program. So the National Diabetes Prevention Program is a partnership of public and private organizations, and we work to prevent or delay type 2 diabetes. So this is an evidence-based lifestyle change program with CDC recognition. So if you see that a diabetes prevention program has CDC recognition, you know that it has been vetted by the CDC and the curriculum has been approved. So this, go back, thank you. So this program can be offered in your workplace as a wellness program. It can be offered as a covered benefit of your medical plan. And again, you can do that screening to identify at-risk employees. And this is a one-year intervention to address those with pre-diabetes. And it includes a couple sessions. It can be on-site, it can be off-site, it can be online. And this program really teaches employees strategies in healthy eating, weight loss, stress management, physical activity. It teaches the behaviors that prevent type 2 diabetes overall. Next slide. And this diabetes prevention program is research-based. So the CDC recognizes this program. It was based on a study done by the National Institute of Health. Next slide. And the study that was done showed that people with prediabetes who take part in a structured lifestyle change program, like the diabetes prevention program, can actually cut their risk of developing type 2 diabetes by 58%. So just by someone being in this program, their risk goes down by more than half. And for those individuals who are 60 years of age or older, their risk actually decreases by 71%. So these findings were the result of helping the participants in the program lose about 5 to 7 pounds of their body weight through healthy eating and about 150 minutes of physical activity per week. So for example, for a person who weighs 200 pounds, losing 5 to 7% of their body weight might mean losing about 10 to 14 pounds. And even though losing 10 to 14 pounds over a year doesn't sound like a lot, research has shown that this weight loss drastically reduces their risk of developing type 2 diabetes and has a big impact on their health. Next slide. We also see that the impact from the diabetes prevention program has a long-term effect. So research has found that even after 10 years, people who were part of a diabetes prevention lifestyle change program were 1/3 less likely to develop type 2 diabetes. So we do see it having an effect in the long term as well. Next slide. Okay, and the diabetes prevention program, so what it includes is a CDC approved curriculum. So this curriculum has lessons on healthy eating, physical activity, stress management. It also includes a lifestyle coach, specially trained to lead the program. So if participants are going, or employees are going to an in-person program, the health coach is going to be the person teaching the classes. If they're enrolled in an online diabetes prevention program, then in most online programs, the participants or employees have access through text message to that health coach to help them keep motivated and make those lasting behavioral changes. The program also includes a support group of people who also have prediabetes and are also in the program. And this is because it's been shown that when individuals have a support system, they're more likely to want to keep going with the changes that they're making and see more of an impact in their health. This program includes 16 weekly sessions in the first 4 to 6 months, and then 6 monthly sessions over for the last 6 months of the program. So again, it is a 1-year program, and we're looking for a 5% weight loss and about 150 minutes of weekly physical activity. So this is definitely a program that helps individuals learn how to integrate habits that they're going to keep for the long term. So it's not a quick fix type of program. Next slide. Okay, so offering the National Diabetes Lifestyle Change Program as a covered benefit to employees can help you improve their overall health and reduce the medical expenses attributed to type 2 diabetes. And the workplace is a good place to start as an initiative to help the employees, support each other through prediabetes and bring awareness to what prediabetes is and help them prevent the development of type 2 diabetes. So remember, for those employees who develop type 2 diabetes, their medical expenditures are nearly 1/3 higher than those employees who did not develop type 2 diabetes. I'm sorry, next slide. So we do see that cost savings. And when it comes to bringing up the diabetes prevention program to your company, looking at the numbers and looking at how much you can save can be a good way to start that conversation. The annual cost difference from an individual moving from pre-diabetes to diabetes is about $2,671 per year. And some research shows that the 3-year return on investment for National Diabetes Program is estimated to be as high as 42%. Next slide. Okay, and just a little bit more information on cost savings. So studies have shown that an average savings over 10 years can range from around $4,200 to $6,300 per participant. And the Montana Department of Public Health estimated an annual return on investment of around $1,132,000, assuming that 700 people with prediabetes enrolled in the diabetes prevention program, and that the program led to the 58% risk reduction in type 2 diabetes over the 3 years that the program was administered. It was also estimated that with an increased participation in the program, the return on investment would likely be higher. So based on the return on investment, the Montana Medicaid program opted to provide the diabetes prevention program as a covered benefit starting in 2012. So there's definitely organizations who are implementing the diabetes prevention program, and they're seeing the value in the program and the outcomes that they're receiving, and the impact that it's having on the medical cost for diabetes or preventing type 2 diabetes. Next slide. Okay, so here I'm showing the diabetes prevention cost calculator. So you can use this calculator to calculate your potential cost savings from providing the National Diabetes Prevention Program as a covered benefit, if you choose to do so. And you can also use this calculator to start the conversation with your organization. And this calculator shows you the net savings over a 3-year period for implementing the National Diabetes Prevention Program.
And I'll just quickly put a plug in too. I know if you're in Colorado, our health department has really worked hard to adapt this calculator to the costs that it would be more closely associated for a Colorado employer. So you can also, I'll make sure to include the link to that as well in the follow-up, but it's just more specific to Colorado prices, but this is a really great resource. Thanks for sharing that, Vanessa.
Awesome, thank you, Kaylee. So here, just an example of this calculator. So you can enter your population size, you can enter the cost of the diabetes prevention program. So on average, the cost of a DPP program is about $450 to $500, and on average $450. So $450 is a fraction of the amount that employers can expect to pay if an employee develops type 2 diabetes. You enter the prevalence of diabetes, your anticipated enrollment, and anticipated completion. And this gives you your potential 3-year net savings for implementing the DPP program. And this is the net savings for avoiding medical spending associated with the newly diagnosed type 2 diabetes in your employees. Next slide. Okay, I just added some resources here if you would like to learn more. I put the link here on the bottom. So the National Diabetes Prevention Program on the left gives you information on how to cover it as a benefit. And here on the right, This provides resources for employers on how to bring up the conversation with your team, your company, why diabetes prevention is good for business. It shows you how to offer or guides you on how to offer and implement the National Diabetes Prevention Program in your organization, and how to engage your employees, and how to bring awareness about prediabetes and the diabetes prevention program. Another resource that I didn't include on here, but it may be helpful, is the CDC Diabetes Prevention Impact Toolkit. This lets employers look at the cost of the diabetes prevention program, your diabetes related medical costs, and the potential return on investment from implementing a diabetes prevention program into your company. Next slide. And I'm going to send this to Kaylee. This is just a resource that outlines the 8 steps to implement the diabetes prevention lifestyle change program in your workplace. So it just gives you more information. Next slide. Okay, so I'm just going to end with 3 mindset shifts for a healthy workplace. So these are, very simple and maybe a bit general. But I believe it's sometimes something that we forget when we're implementing programs with our employees. Next slide. Thank you. Okay, so your work environment. So being mindful of your work environment. So this is very simple and we all know it, but if we're implementing a program, let's say like the diabetes prevention program, to help people live healthier lives, we have to keep in mind the environment the employee is in. Because if we encourage or promote a behavior and the employee doesn't have the ability to do that behavior, it's going to lead to frustration and to an employee giving up and not wanting to participate in the program. So think about that when you start looking into the diabetes prevention program. If you want your employees to, if you want to bring awareness to what is prediabetes and have your employees take that risk assessment test, try to make it as easy as possible for them to take that test and to share the results with you. Next slide. Next is remembering that simplicity is key. So in order to make certain habits or behaviors happen, we need to make things simple and easy to do. So for example, going back to the diabetes prevention program, if you are looking into offering the program, keep in mind what's going to work better for your team or your employees. Is an in-person diabetes prevention program going to work? Is a virtual program going to work? Do that assessment to see what works best for your employees, so you make it simple for them to say, yes, I want to be a part of this program and I want to prevent type 2 diabetes. So remember, simplicity is key. Next slide. And the last thing is advocating or encouraging the implementation of habits and iteration of those habits. So if you're doing, let's say, a team weight loss goal, instead of having everyone set a weight loss goal, you can have them set that weight loss goal, but also have them tell you what habit they're going to implement to reach that goal, and allow your team to iterate that habit to figure out what works best for them. So for example, if I want to lose 5 pounds and I say I want to lose 5 pounds by going to the gym, my habit would be packing my gym bag and putting my bag in my car, and after work, driving to the gym. So that's my habit. And I can see how that works for me. And if that habit doesn't work, I can change it and figure out what works best, instead of just making my goal to lose 5 pounds, but not setting up my road or the habits I want to do to help me get there. So having that in mind when you either have a program or develop a program, it's not so much about the goal you're trying to reach, like a weight loss goal, or preventing type 2 diabetes. It's about how are we going to get there and what habits are we going to put in place, and allowing people to iterate and change those habits as needed, so they're able to reach their goal. Next slide. Okay, so that's all my presentation. I hope that this was a good introduction to the diabetes prevention program. And thank you so much, Kaylee.
Thank you, Vanessa. So feel free to start typing in your questions. I'm curious if you have any insight or what you've heard, out on the streets, so to say, like what are the barriers to people participating in the programs, and, how can employers really advocate for their employees to engage?
Yeah, so definitely awareness is one of them. Like I mentioned, 9 out of 10 people with prediabetes don't know that they have it. So when it comes to doing a risk assessment, there can be some pushback with them, because they might say, oh, my doctor's never told me that I'm diagnosed with prediabetes, and that prediabetes is kind of a new thing. We know that individuals with diabetes get diagnosed with diabetes, but a lot of doctors are starting to have a conversation about prediabetes. So that's one. And another thing, being mindful of the type of diabetes prevention program that you offer to your employees. Because if somebody has a long workday and then they have to go once a week to an in-person program, it might be difficult for them to show up for that program. So thinking what works best for your employees.
Yeah, and even potentially, surveying and asking them that is probably a good idea too. On that note, could you talk, if you feel comfortable, about kind of your innovative take to the program and how you're using and incorporating technology to reach employees?
Yes, so my program is full with the Latino Hispanic community. It's not per se employees, but that is the Latino Hispanic community is a community that has a lot of barriers when it comes to time, money, ability to go to a program. So what we did is we designed this program, and we have a mobile application where the participant doesn't have to go to a in-person program. They can view the session or the educational session on their phone. They have access to a health coach on their phone. So we're really working hard to make it easy for that patient or participant with prediabetes to enroll in our program and participate.
I love that. That's great. Well, I don't see any other questions coming through, but if things pop in your mind later throughout the day, my contact information will be there. I'm happy to, field those questions, connect you to Vanessa. Her information was also back on a couple slides there as well. Before we jump off, I just wanted to review a couple of the upcoming events that we are going to have. So our next webinar is not going to be until January 23rd in 2019. So after the new year, same time as always, and we're going to take a look at opioids and the influence on the workplace. Should be a really riveting conversation and just really educational. So I encourage all of you to try to attend and spread the word to your friends and colleagues. And something to note, I'll be posting a registration link here shortly. But I'm excited to announce that we in 2019 are going to start offering SHRM credits, so Society for Human Resources Professional Education credits. And hopefully we're in the process also of getting approved for some additional continuing education credits. So be on the lookout for that, but I'm excited to really be able to start offering those for this webinar series. And I'd also just encourage you for any of our live events or things that might pop up between now and this January 23rd date to look at our events calendar, see what we have going on, and join us. As always, if you're interested in becoming a certified healthy business, you can contact us with this email. You can go directly to our website, healthlinkcertified.org, or you can contact me directly, and I'd love to talk with you about how we can get you there and what are the steps to take. And additionally, just for our Colorado employers, if you are with employees under 500, we would love to have you join our Small Safe Well study, which helps us really gauge what's happening in small employers in terms of employee health and safety, and helps us provide to the body of research out there, as well as refines our practices while working with employers. And last thing, if you are just as passionate about HealthLinks as I am, I encourage you to become a HealthLinks ambassador. You can click that link when I send you these slides, or if you want to email me directly, I'm the contact person for that, and I'm excited to lead a group of people who have had a positive experience with HealthLinks and really want to help other employers improve their total worker health programming and policies. So thank you again, Vanessa. I truly enjoyed your presentation. I'm excited to see what all comes of your future work, and it was really great to have you on and speak to this, so thank you.
Thank you.
All right, everyone, have a good Wednesday, and I'll see you next month.